To me, palliative care is about respecting the individuality, the dignity, the goals, the life meanings of an individual patient in the way we care for them at the end of life.
To me, palliative care is an interdisciplinary approach to meeting the needs of a person with a serious illness. I think palliative care is especially critical at the end of life, but it is certainly not restricted to the end of life.
Well, thinking about it in terms of young adult oncology, I think what palliative care can bring is really a patient-centered, comprehensive perspective on care, and that is going to look different perhaps in young adults. Like I mentioned, the focus on social support, for example, may be particularly relevant, or palliative care may need to think about different ways of implementing various strategies that are more palatable to younger adults, things like peer support, for example. So it's that patient-centered, comprehensive care that really looks at the whole individual that I think is one of the very unique aspects that will be applied in ways particular to young adults.
I believe palliative care is providing care and support for the whole patient and their family.
So palliative care is reducing distress and improving quality of life, and doing that in a clinically meaningful way. And the targeted audience is patients with serious illness, their caregivers, and actually the whole medical system as well. So really it's an educational maneuver, it's a clinical maneuver, it's a quality improvement maneuver. But the basic components are prognosis is irrelevant, and actually amount of need is irrelevant. It's really saying all patients with chronic and serious illness have some sort of unmet need, and that's where palliative care fits in. So it really depends on the patient and the clinical situation how you define it. There's not one general definition.
Palliative care to me is whole person care. It's not a new concept, but in a sense, it is a new concept brought into a medical environment, which is reductionism. So instead of focusing just on disease, one focuses on disease and illness. I think the patient's experience of the illness, which involves multiple domains, including psychosocial, spiritual, as well as physical. So it's focused really on illness, while oncology is frequently focused on the disease.
So in our brain tumor patients, what we do from day one when we're taking care of these patients is palliative care. So we are going to give them all the treatments that will help them live longer and live better. And unfortunately in this tumor, because of how things go and cure not being possible, the symptom control issues, quality of life issues are important from the very beginning.
Palliative care is the total care of a patient and their family. It's looking at all aspects of their life: physical concerns, emotional concerns, spiritual concerns. And the benefit of palliative care is improved quality of life.